headquarters of common sense.
Talk Radio.
Now, Matthew Taylor and the NHS Confederation are calling for a return to full mask wearing and social distancing and the sort of COVID restrictions that we thought had gone away forever but used to predominate about a year ago. Why do they want this retrograde step? We need to ask about that. But first of all, David, you're a medical man, you're a GP. What is the NHS Confederation? Because I've been looking it up and it's hard to work it out. It says, the NHS Confederation. The NHS Confederation is the membership organisation that brings together, supports and speaks for the whole healthcare system in England, Wales and Northern Ireland. We empower and support healthcare organisations to improve population health, deliver high quality care and reduce health inequalities. It's got nothing to do with the health system, has it?
Well, the thing is, and when you talk to people about the NHS, most people are under the mistaken impression that the NHS is one body. And of course it isn't. It's split off into many, many different parts and it acts as one body. And so I also looked that up. And once I'd read that definition, I was no wiser either. Oh. But essentially, they look after all of these vested interests. So in there, you've got things like the acute trust community networks, you've got mental health networks, employers network and some primary care networks. So essentially, they're almost like a trade body, but it's a membership organisation. And when I looked at their funding, they also get a quarter of their funding from government. So the thing is that these people are not, basically what this smacks of is more bureaucracy. And as you know, and the thing I keep banging on about, 48% of the budget for the NHS goes on staffing and on things like this.
And as I say, it's run by a former senior member of Tony Blair's Labour administration. He's Labour through and through, Matthew Taylor. Why is he wheeling out this kind of antediluvian stuff about returning to full mask wearing, social distancing, being careful in pubs, being careful in restaurants, all the sort of stuff that kind of died out around about Christmas, but we used to have to endure about a year ago. Why does he want to bring it back?
I think there's a very big disconnect between hospitals, what's going on in hospitals and what's going on in the real world. And clearly, they've got a very one-sided view of things. In a hospital where I was today, we're back on mask wearing. They still got COVID distancing. Now, clearly, we've had a spike in COVID admissions. But remember, the vaccination did two things. It broke the link between becoming seriously ill and also dying. So, in fact, we will always see peaks and troughs, just as we do with flu. And the point is that we need to learn to live with this. Now, back in the real world, of course, we have now relaxed all those COVID rules. And actually, what have we seen as a result? Well, we have seen some spiking, but that spiking is now going down. And the fact is that COVID is now endemic. There is no way you can have a zero COVID policy, which some countries are trying to achieve. It's absolutely impossible. And we have to learn to live with this as we do with many other diseases. So the NHS Confederation should concentrate, in my view, at actually getting through the backlog of patients, 6 to 8 million people waiting for elective procedures. The fact is you cannot see a GP. You have to go through this lottery at 8 o'clock in the morning where you try and ring and get an appointment, which is in 3 weeks' time. Actually, I think there are better things to concentrate on.
Indeed. And of course, Matthew Taylor was trotting out the usual narrative that the NHS is sorely underfunded by the Tories.
Well, it's not.
Who want to privatise it. Let's just put this into perspective. The NHS gets about £200 million a year as a matter of course. We gave it an extra £36 million this year to help clear the backlog. It is swimming in money. It is only bad organisation that makes it strapped for cash, because it is notoriously terrible at knowing how to spend the money we give it properly.
That's right. It is actually very well funded if you look at comparable health systems across the world. And the fact is that it just doesn't talk to each other very well. And the fact is we've got primary care not really talking to secondary care. That's GPs and hospital settings, for example. One of the biggest problems is we didn't put enough money into social care. So we have lots of bed blockers. So elderly people who can't get out because there's nowhere for them to go. And actually, I blame successive governments because they reduced the number of beds. So there's less capacity in hospital. but at the same time, tripled the management structures. And of course, we've spoken about this before. The fact is, I look today, they're advertising for sort of inclusivity managers in the hospital. And as I've said repeatedly, if you're having a heart attack, you want to see a doctor, not an inclusivity manager. It's time someone got a grip of the NHS. And the fact is, you can't just solve the problem by throwing money at it. It becomes a very expensive problem. And it needs wholesale branch and root reform.
Yes, you could call for the inclusivity doctor, or, as was advertised recently, the diversity matron.
That's right.
These are the kind of jobs that the NHS is wasting our money on. What about the mask debate, though? Let's get this into correct perspective. Basically, you know, a lot of people, doctors in particular, you know, they say masks definitely do help stop the spread of the virus. But there are also a lot of medical experts who say quite the reverse. So you cannot put it forward as an absolute scientific fact that mask wearing stops the spread of the virus, is good in terms of curbing the pandemic. You cannot put that forward as 100% fact, because many medical experts say quite the reverse. So why is it that the NHS in particular and various other elements of society insist on saying it is a 100% scientific fact that mask wearing will stop the spread of the virus? Because it's not necessarily true, is it?
Well, what is true is the masks that you and I wear, the ones that we have that are disposable, do not protect you from COVID. The idea is actually they probably protect you from spreading some germs, but not very far. What you need is surgical grade masks, or very fully protective masks to do that. But the point is actually they've missed the bigger and wider point here, which is what is the impact on society? As I said, you've got all these businesses who've actually gone out of business, or indeed have very high loans. We've got children who didn't have their proper education. We've got problems with children with social interaction skills because you only ever saw people's eyes. And we've instilled this sort of fear into the general public. And I think there is something in this, in the saying that sometimes I don't think they want to let this go because they had power. And it's worth remembering that we pay for the NHS. The NHS works for us, and not the other way around.
Yes, we're all sick to death of protecting the NHS, and we would really like the NHS to do its job and start protecting us, start looking after us. To go back to the mask debate, David, now, the one place, or the one type of place where you still where 100% mask wearing has never stopped is in hospitals.
Yeah.
So everybody wears masks in hospitals. They're required to. Now, where is the best, should I say the best place to catch, or the worst place to catch COVID?
In a hospital.
So,
yes.
Does that not prove that masks aren't particularly effective in stopping you catching COVID, or indeed spreading it?
Well, of course, you see, going back to the whole, the way the pandemic unfolded was the fact is they were unprepared. What actually spread it, and we saw that, didn't we, was the discharges from hospital into care homes. That was absolutely a disastrous move. And there's no doubt that people will come into hospital. They may test negative for COVID when they come in, but they may well develop it later on. So the fact is you will never eliminate it. And why don't we test people for other illnesses before you go into hospital? I just think this obsession with COVID and ensuring that you have fewer patients going in, all these telephone clinics being done instead of seeing patients face to face. And I don't think that's necessarily a good thing in the terms of patient outcome and efficacy. And until we actually get the NHS back up to full capacity and clear some of that backlog, which, by the way, I don't think is possible. And I think you're going to see a real problem for the NHS going forward. And it's not just about money. It's actually working out how on earth we get through that backlog. Now, Reform UK, the party I am deputy leader of, suggested that we liberate private capacity to do that. And suddenly the government has nicked our idea. And it is one of the only ways, I think, that we can get through the short-term backlog.
Good talk.
Hot talk. Bold talk. Talk radio.
Listen on your smart speaker.
Watch it live on your smart TV.
The world headquarters of common sense.
Talk Radio.